Hello, everyone. My name is Defina Felix, and this is Case Study 3. Okay, we are going to be talking about I-4, which is train personnel to competently perform assessment and intervention procedures. We use BST in our clinic. We were taught to use BST, and I am in charge of the pairing protocols of the clinic. And when it comes to the client that I'm working with, I teach the newcomers how to pair with him. So we use behavior skills training, which is an evidence-based teaching procedure that merges the understanding of a skill and the ability to actually perform that skill. BST utilizes a systematic approach of 6 steps: rationale and or operational definition. So the rationale behind the pairing protocol is just basically to make sure that we are paired with the client and pairing ourselves with their highly preferred material activities or toys in order to build some type of rapport for them to do the protocols that we require from them. So that's the whys of the pairing protocol. Then the next step is to provide clear and concise instructions. So the instructions of the pairing protocol, you basically give yourself a 5 minutes. You can set a 5-minute timer, and where you're calculating the approaches and the escapes of a behavior of the kid. So if a kid comes up to you, engages you of any kind of sort, then you're marking that as an approach. And if they do any type of escape behavior, such as running away, swiping out your hand, crying, that is an escape. At the end, we are going to make sure that we're calculating our approaches divided by our approaches and our escape to get us the percentage. The next step would be modeling. So I am going to perform the task, and I'm going to have so much fun, throw a party, and then I want you to do the same thing and make sure that you are able to we go to the rehearsal. So that's where I want you to do the same thing and make sure that you're able to pair with the client as well. While you're pairing, I give feedback during it. I do not like to wait to the end to provide the feedback because I don't want you to get used to practicing the wrong target. So the last step after that will be to repeat until mastery. So in this slide, we are going to be talking about validity and reliability. So reliability is about the method's consistency, and validity is about its accuracy. So after running the pairing protocol, we just want to make sure that the passing score actually means that you are paired with the client and they are willing to do protocols with you, that they're willing to actually try and give their best and not just be rote responding. So we do this by getting 3 independent trials in a row of the learner demanding for items from you, and then 3 independent trials in a row of the learner completing high probability demands. When I say in a row, I do not mean mass trialing. So you don't ask the client, what is it? What is it? What is it? You ask them, what do you want? And they say what they want, and then you go and you play some. Then you run that again. What do you want? They say what they want, then they go play some. You want to put some time in between those trials of demanding and then completing the high probability demands. And to test validity, we make sure that we are taking data along with the therapist and completing IOA data to make sure that our data points are at least 80% in agreement. So at the same time, I'm like, as they're clicking or they're using their iPad, I like to use clickers because it's easier to look at. I make sure that I'm tapping it as well. And then we analyze the data after. Okay, so we're going to move to I-5, and that is where you use performance monitoring and feedback and reinforcement systems. So this is where we're going to be talking about the competency checks. So after we get the one-on-one training, we then move into performing the pairing protocol with the client, and then after that you're subjected to get a competency check from the BCBA. While we're with the child, I make sure that I take the same format the BCBA does use and make sure that you are going to be exposed to what they are requiring of you in written form, and I make sure that I provide that feedback at the end, of course, just to make sure that they brush up on their skills, because if they don't verbally tell me that they will need more help, when I ask them, that will be the last time that we will be practicing before their actual competency check. So, um, yeah, if they do ask for help, that gives them more opportunities to practice the concept, especially if it was harder to grasp, and give them a chance to receive even more feedback to enhance their skills. Um, I also provide verbal praise whenever they are displaying the correct thing and showing that they are competent. I like to give them verbal praise if that's what they are into. Sometimes I bring candy. It's just depending on the day. At the end of the 3 months, the company, I don't give them the dollar raise, but the company gives them a dollar raise when they pass each competency. It's more than just pairing. I'm in charge of pairing, but that's just one of the, I think, 6 competencies that they have to eventually pass to get to that dollar. But yeah, that's how we do the competency checks. Okay, so now we're going to be talking about performance diagnosis, and this is I6, which is to use a functional approach to identify variables affecting personnel performance. So sometimes the staff members fail their competency checks, and it's okay if that happens. There's always an opportunity to get you some more practice. It just means that the dollar raise is kind of pushed back, but it also, that dollar increases your likelihood to go harder and work harder for it to you, so you can gain the competency and the extra money. So it's like a reinforcement in place, of course. But yeah, so if they fail it, I always try to find a different way to help them obtain the information. I try not to go back and teach them the exact same way, because obviously something that I did wasn't working. I have to model, and I have them model what I taught them and what they took from it, and I provide feedback as the error occurs. And then I also provide them different ways. I ask them, how could I help you better obtain this information? I give them like 2 to 3 ways, and then they pick from one of them, and then I show them how to do it based off the one that they picked. Because some approaches may just be a better fit. Then I do the BST over. I do the BST steps with that modified version. Alright, so we are going to be going into I7, which is determining what function-based strategies to improve personnel performance. So when improving personnel performance, you can look at the functions that's causing the disconnect. Most of the time, the trainings are up to 5 hours. This is a long time for anyone to stay focused on any task. So oftentimes, I like to ask questions. It's kind of like a little test. Sometimes I ask a question that's not rhetorical, and I get I get the wrong answer. So say if I ask I ask a question, sometimes they answer with yes or no, and I'm like, okay. I try not to make faces. I'm working on that, but I'm like, okay, they're obviously not here with me, so I offer a break. I try to give breaks as much as possible, but I also have a time slot to fill, so the breaks can't be too long. I just give them like a little 5 to 10 minute relaxation of you can relax your brain. It's okay. Because it's kind of pointless if I'm sitting here shooting information at you and you're not picking it up. So yeah.